a lot of material, but like people have survived in the past, so you guys are going to survive too. So don't worry, but you do need to like keep on top of it, but it's doable. So no big questions. Dissections are going okay, despite the lab manuals. Yeah. So there's resources out there. There's videos. I just used lecture notes and brought it to lab, because that's kind of like the most important things that you need to know. Whatever's in the dissection guides, I don't think like is pertinent information.
And we'll try to point out the main things that they focus on, because there's a lot of material in those dissection guides, and I'm telling you guys, like 3/4 of it is not relevant at all. And we've spoken to Gary about it. Can you please change the dissection guides? But he hasn't gotten around to it yet. So, yeah. So no questions. Everyone feeling okay?
Not the right.
It'll be fine. So. Okay. So who can tell me what this is?
Stomach.
Okay. So do you guys know how to orient yourselves with this?
Esophagus.
So what part of the ruminant stomach is this?
Reticulum.
Oh yeah, sorry. My bad.
Reticulum.
This part. Yep. So if he just reticulum, yeah. So reticulum means honeycomb. So it has this honeycomb appearance on the inside. Do you guys know what part of the stomach this is? Like how you would orient yourself?
Yeah. So if he like puts this on the table like this and inside out, that's probably the best way to orient yourself, because you need to like be able to assign different sides to things based on that. So that's a good starting point.
So what is this? I'll try to turn it.
Omentum.
So what side of the stomach would this be?
Right.
So this is a question that we got asked. He asked, which part of the ruminant stomach cannot be seen from the left side? The omasum. That's the only part that you cannot see from the left side. I don't know how that's relevant, but yes, it's. What's this part?
Abomasum.
And then this, the rest of it. So you guys just did the grooves in class, right?
Yes.
You guys want to go through some of them?
Yes.
So what side did we say this was?
The left.
So what would this guy be?
Left longitudinal.
Yeah. And he's very big on details in this course. So if he tags this, he's going to want left longitudinal groove. So as, yeah.
When you ask questions, can you repeat the answer? Because this far back on here is muffled.
Oh yeah, sure, no worries.
I'm recording it just so. Is that okay? I didn't ask you guys.
So this is the left longitudinal groove. Do you guys know what this guy is right here?
Accessory groove?
Yes.
Ventral
that would be
accessory
your
groove?
Left accessory groove. You guys see?
Left.
Left accessory groove. Yeah? What's this guy right here? Heard it. Coronary. Yeah, close. So we have your left dorsal coronary groove. You guys see? You guys can come up at the end too, and I'll go over this because I know it's really hard to see. And then this would be your left ventral coronary groove. You guys good with that right here?
So this specimen, just so you know, is in the bone room, and you have the diagrams from the lecture material, so it's useful to just come in, look at it, see if you could do that on your own. You'll need to do it with the wet specimen, which is probably a little less obvious than this one, so definitely know that in or out. We were saying before, like probably 10% of our midterm was just on the ruminant grooves and fillers and whatnot, so know it really well. Have this.
Okay, so what would this guy be?
My nose was
There. Right longitudinal groove. Okay. Do you guys know what this one is right here?
Right.
Yep. Right accessory groove. So what is this thing that is bounded
The
by?
island.
Yes, the island of. Yes, good job. So this area right here.
Also known as insular ruminous.
And we asked him whether we have to use like insular ruminous or island of the rumen, and he said he doesn't care. You can say whichever one works best for you, whichever is easier to remember. What's this? And if he put a string around this part right here, what do you guys call this part? Yeah, caudal transverse pillar, or groove, sorry, caudal transverse groove, right here. And then your cranial transverse groove is right here.
Okay, so all these grooves that we're talking about, if this was cut open and we were seeing it from the inside, what would it be called?
Pillars.
Okay, good. Except for what structure? Good, good.
So what's this right here? Do you guys know? Yeah. Ruminal-reticular groove. So just like look at where it's between. So you have your rumen here and your reticulum here. It's the groove between those two, so it's the rumino-reticular groove. Okay. Have you guys done the internal structure yet? No. Should we just do it?
Sure. Go over a couple things.
Sorry, can you hand me that one? Thank you. Okay, so he also told us that he could cut a piece out of any of these specimens. So like this, for example, and just put it on the table and be like, what part of the ruminant stomach is that from and why?
Good. Good.
What about this one? Do you guys know what these are called?
Okay.
What about these? Do you know what these are called? Yes. So this is your omasum right here, and these are your omasal laminae or omasal leaves. They were named that way because they look like leaves in a book that like fit together. Do you guys know what the space is between the leaves? Because he has tagged that before as well. Just like shoves a piece of paper in there.
What is this?
Yeah. So that is, does anyone know? No. No, so this is your interlaminar recess. So inter means between, so between the laminae. The space between the laminae, basically. What else? That's it.
That's more or less it.
What are these? First of all, which part of the stomach is this? You guys know? Yeah.
And what's the true stomach of a ruminant?
And what are these things called inside of the abomasum? Yeah, so abomasal folds. Again, be really specific with him. So if he tags one, say abomasal fold. Don't just say fold. So those are I think the main things you need to know. You need to know reticular crests. That's what the honeycomb structures are called. Reticular crests, ruminal papillae, omasal laminae, and abomasal folds. Those are the overall internal structures of the stomach. And he does like tagging those. You can tag any.
And do you guys know what the reticular crests make? What is in between them? The reticular cells. So if he tags like this ridge, that's the reticular crest. Inside is the reticular cell. So just pay close attention when you're answering questions like that.
Sorry?
Cell versus
That's it. Okay, so the reason we put this out here is because he starts with the skin derivatives lecture for you guys, right? And he tagged this for us on our midterm. what would you guys call this? Yeah. So some people wrote horn, and he's like, that's wrong, because the horn is the derivative from the skin. So you have to say cornual process of the frontal bone. Yeah. You guys will get used to it, don't worry, kids. Stressed me out the first time too. So this is your frontal bone, and this process is actually an extension out from your frontal bone. So cornual means horn, so cornual process of the frontal bone. Cool? Let's do the next passage.